we get stories, at least every couple of weeks we hear about stories with people who had that, particularly now we have newer residents moving into the community because like throughout a lot of the larger cities, there's gentrifications, people moving in and out of communities. And I think we have newer residents moving in. And some of them have not had health care based on where they've lived before, or health care within this close proximity to where they live. And health care, I'd say, how should I say this? Primary care provider within close proximity, or a health care facility that offers not only health care but dental care as well. So I think we get stories of patients coming in saying, I'm so grateful for this because without this, we have an asthma program. We had a story the other day with an asthmatic because the hospitals, although it's within about 10 miles from our health center, it's still transportation is hard. Some of them, they're not thinking of immediately calling an ambulance. So they run into our front doors. So just last week we had an asthmatic, and one of the doctors, before I left the health center Tuesday, she's telling me this person walked in and they're breathing. They're about to go into a cardiac arrest because it wasn't the normal, it was just those quick breaths of air. And she said they came in, we had the necessary emergency equipment and the staff on site to deal with that situation right away. That could turn out to be really, really bad. That patient could have died if they'd waited for an ambulance, and if we weren't located right there with the trained staff to deal with that issue. They later on called an ambulance, but we were right there to stabilize the patient.